Here today to talk about an oftentimes overlooked trace metallic element, lithium. So first thing I want to do is open up with a quote from a gentleman that is somewhat famous in pharmacology circles. His name is John Cade. He was an Australian psychiatrist that was one of the first people to look at lithium as a drug of choice for a lot of psychiatric disorders, especially bipolar disorder, to which it continues to be one of the primary agents of choice for treating that. Of all the theories of how lithium is actually exerting its effects, one of the kind of core underlying concepts I think is the most important is it will upregulate production of bdnf, or Bravo Delta November Foxtrot, also known as brain-derived neurotrophic factor, which is a neurohormone produced by the brain that actually will tell the brain to start forming connections, increase the cell viability, so their ability to survive. So the first study I want to talk about is actually how I first became aware of low-dose lithium as an option for patients. I was doing a case report when I was doing my residency, looking at a patient that I got to know pretty well that was using lithium for bipolar disorder. Was able to ask him a ton of questions, really get an insight on how that disease worked and his relationship with the medications he was choosing to manage it. But while I was doing this deep literature search, I came across this study looking at groundwater, where lithium will actually naturally occur. And this groundwater, they compared county by county in Texas and had some controls for things like population density. But they were looking at kind of broad demographic information, so how many homicides, how many suicides occurred in that county per capita, and they found that it was statistically significantly related to the lithium level. So in counties where lithium was occurring higher in the groundwater, or individuals were going to be having more exposure over time, getting those low amounts, in comparison to counties which had very low amounts of lithium found in the environment. They found that lithium had a beneficial effect in terms of reducing homicide or aggressive behaviors. They saw reduced burglaries, and then also suicides. So reduced depressive behaviors. Another thing that was very interesting that they found in that study, they also looked for arrest rates per capita for addictive drugs, specifically cocaine, opioids, and morphine derivatives, and found that in areas that had a higher lithium amount, they were seeing less signs of addiction in terms of arrest rates. So that Texas study actually occurred in 1990, which resulted in a lot of other countries looking at lithium and trying to conduct their own studies that were very similar, with the idea of, hey, maybe this is something that is worth looking at to help protect our population. One of the biggest countries that was looking at it afterwards was Japan. So Japan was looking at 18 different municipalities in the Oita region. So they were looking not by county, but more city. And they were looking at these demographics between 2002 and 2006. So the next study I want to cover is a study that came out of Japan between 2002 and 2006. And they were looking at a little bit more honed in, so they were looking at different municipalities within the Oita prefecture. So we're getting even tighter in terms of the scope of how many patients we're looking at or how many subjects we're looking at. They were specifically looking at suicide per capita, really hoping to prevent that, and found significant differences. So they came to the same conclusion that lithium levels in their groundwater had an effect in reducing suicide rate amongst their citizens. Another country that was looking at it was Austria in 2011. This study I found particularly compelling because of their control methods. So they took 6,460 different measurements of lithium within the drinking water in 99 different districts throughout Austria. What really impressed me about this study is they had even more controls for those potentially confounding factors that might muddy the waters in terms of, is lithium the only factor that could be explaining these differences in suicide rate? They looked at population density, which is super important. They also looked at that in Texas and the Japanese study. But they also brought in per capita income levels, proportion of Roman Catholics, and also the availability of mental health resources within those different communities. With these factors all considered, the difference rate between suicide in areas with high lithium exposure and areas with low lithium exposure were actually magnified. So they were even more confident that, with accounting for these differences, that there was a significant effect of this low-grade lithium exposure in that community. All right, the next study I want to look at is actually kind of going back to that Texas study from 1990 that we started with. That was examining the role of lithium in terms of addictive behavior, looking at specific drugs that people were being arrested for and examining those arrest rates. So this is actually a newer study. It came out in 2020. Worth noting that this study was using 150 milligrams of lithium carbonate, which is prescription strength but much lower than the amount used for bipolar disorder in typical situations. So it's kind of providing more of a proof of concept rather than direct evidence for this low-dose lithium. But I wanted to include it because the results were so striking and really interesting to me. So this 2020 study was looking at residents of a residential addiction treatment program in New York City. So they enrolled a total of 335 subjects. They were looking before they implemented this formulary change. So what drugs are we going to be using to treat the patients that are coming into our clinic? In the second stage, they were using 150 milligrams of lithium carbonate. And they found some really interesting benchmarks that are associated with kind of recovery and program completion. So in the lithium arm, the dosage of a medication that is used to, it's a synthetic opiate, but binds less strongly than things like heroin and oxycodone. So it's designed to help reduce cravings and reduce the risk of relapse. And one of the markers of recovery is how well they're able to slowly reduce that dose while keeping the patient comfortable. So in the lithium arm, the patients had a 50% lower dose of that medication, which can sometimes take months or years to really get down that low. So that was the first piece of information that I found really interesting and compelling. Another one is benzodiazepines are a class of anti-anxiety medications which can be very effective, but they are controlled by the government due to high risk of addiction and dependence on their own. So great for short term, but not so much for long term. For the patients using this lithium, they found that their benzodiazepine use was actually decreased by 99%. An alternative agent, you'll see a lot of people that experience like depression that isn't controlled with traditional resources will be on a class called atypical antipsychotics. Their use was down 70%. Polypharmacy, or the use of 5 or more different prescription drugs on a daily basis, was reduced by 79%. They have another kind of slew of programs that they were also looking at. So participation in their smoking cessation program increased by 300%. Employment rate, another great sign for recovery, doubled in the lithium arm. And then overall completion of the entire program in this residential addiction treatment program increased by 100%, so doubled. Based on these results in this New York study, I'm really excited to look a little bit closer and keep an eye on new studies coming out looking at lithium in this patient population. We just talk about the ongoing epidemic of not just opium but other addictions, and lithium might be a really interesting area to look at. Maybe we're selling ourselves short and not considering this as an agent, not just for patients that are in addiction recovery, but helping the population as a whole avoid that. Which really begs a question, how does lithium work? So there are a number of theories as to the precise mechanism of lithium, which is kind of interesting considering it's been used since 1949, but there are a lot of compelling areas to look at. One of the things I like considering is what is happening to the brain in a patient that is on lithium versus off lithium. Thankfully, we have a lot of good research that has looked at this specifically for bipolar patients. So patients with uncontrolled bipolar disorder are going to experience literal like loss of brain cell density and volume. So their brains can literally shrink due to the disease. Of all the theories of how lithium is actually exerting its effects, one of the kind of core underlying concepts I think is the most important is it will upregulate production of BDNF, or Brava Delta November Foxtrot, also known as brain-derived neurotrophic factor, which is a neurohormone produced by the brain that actually will tell the brain to start forming connections, increase the cell viability, so their ability to survive toxins and stressful events. BDNF is actually one of the reasons that traditional antidepressants do take a while to work. A lot of people will know that you start the medication and you might be facing a lot of side effects those first few weeks without having true benefit for at least a month or 2 or 3. And the reason is that those neurotransmitters will start increasing their activity, but it requires more time to really upregulate this brain-derived neurotrophic factor, which is going to give the brain basically signal to start healing. So lithium is known to help support BDNF levels, which I view as being really generally important towards mental health, and likely one of the reasons that it is able to exert a lot of benefit even at low doses. So who should be interested in low-dose lithium? So current treatment-resistant depression is oftentimes followed up with anti-anxiety medications, which we kind of covered before could potentially be addicting, creating their own dependence. So there's mixed bag in terms of benefits and risks with that. Otherwise, they'll go to a class of medications that we touched on earlier as well called atypical antipsychotics, which I would want to consider all my options before jumping right to that. So I really encourage any patient that is encountering any concerns with mental illness, or even if they're in treatment for mental illness, talk to your healthcare providers, ask if low-dose lithium is an option worth exploring for yourself. That being said, lithium has a lot of interesting, at least mechanistic evidence that goes beyond mental health and addiction. Animal models are showing some really interesting preliminary evidence showing benefit in Alzheimer's disease, Parkinson's disease, ALS. So really a lot of these diseases associated with old age that we are keeping an eye on, thinking about what can we do to either prevent progression of Alzheimer's or reduce its impact. As we are all living to longer ages, we really need to start thinking about not only our physical selves but also our mental selves. Also, it's really no surprise that a lot of international public health officials are looking at lithium's role in a societal standpoint because of the ongoing opioid epidemic, the burden of dementia that could be associated with rapidly aging populations. So with the increased usage of lithium for these electric vehicle batteries, it's actually something I've looked at before, like, oh, what's the cost per kilogram? It's actually gone up 700% in the last 3 years. But thankfully, lithium as a low-dose supplement, which is something that we sell, is quite affordable. The cost is about $30 for a 60-count bottle. I usually recommend just doing one of those a day. As a friendly reminder, if you find low-dose lithium interesting, feel free to call us and ask us about sending it to you. We can ship anywhere in the United States. And if you're interested in more savings, we do have an auto refill program for supplements where we can ship for free and give you 20% off your total cost. So if you're interested in that for low-dose lithium or anything else supplement related, feel free to give us a ring and we will be happy to help you out. Thank you all so much for tuning in, and I look forward to comments below letting me know what else we can do for you.